To be honest, I think without the lab, you cannot have any cancer treatment because you need an accurate diagnosis to be able to treat. So the lab really is core to any cancer, for any diagnosis, any tissue diagnosis. So we have different types of samples and different sizes of samples. Types meaning we could have a cytology sample. A cytology sample is like a pap smear. You must have heard about a pap smear for screening for cervical cancer. So that comes in, it's a slide, it gets stained, and we can look at it. So in 2 to 3 days, the report should be out. Then there are those cases which are more complex. For example, you have been to radiology. You've seen the kind of work that Dr. Ndumia does. Now she's taking core biopsies, and could be core biopsies of breast cancers because that's her specialty. And for breast lumps. And it comes here and it looks like, okay, this is malignant. So we may send out a preliminary report, maybe in 3 days' time, 3 working days. But then we have to do specialized testing on that particular sample to give additional information that will help the physician and the oncologist who's looking after the patient to manage the patient. We are the only lab, the only clinical lab in East and Central Africa that is College of American Pathology accredited. So it's like one of the highest, in fact, for pathologists, that's for anatomic pathology, that's the highest sort of accreditation, international accreditation that one can have.
So this is a digital mammogram machine. There are different kinds of mammogram equipment. So where you have a digital one, and you also have one that uses a film technique. So with this particular mammogram machine, when a woman comes in, we'll have her breast positioned and we'll apply compression within the breast so that there's no movement and you get better image quality. Once the image is acquired, then there'll be immediate release of the compression, and then we'll change the orientation in which we're taking the images. So the breast will change position. So we take 2 sets of images for each breast. And in addition to the regular images, we take additional images called tomosynthesis images. So this is a tube where the X-rays come from, and then they go through the breast, and the image is captured within this area. When it comes to the tomosynthesis images, the tube is going to move in an arc. So it's going to move 15 degrees this way and 15 degrees that way. And it's going to make cuts within the breast. Then using a certain mathematical formula, it reconstructs the images into 1 millimeter slices. So the regular mammogram would be 1 image from beginning to the end of the breast. And so there's a lot of overlap of the normal tissue, and possibly there's a mass that can be masked within that area. When we do have the tomosynthesis, now you end up with 1 millimeter cuts through the breast. And so that way you're able to separate the normal tissue from the abnormal finding and increases your chance of detecting cancer. So studies have been done comparing just the regular mammogram with the tomosynthesis, and it increases your cancer detection rates by up to 30%. The other thing, when there has been overlap of tissues with a mass, is you may end up calling normal tissue to be a mass, or you may end up missing the mass. And so this helps in detecting, and also detecting cancers, but also reducing the chances of you calling something that's normal a cancer, which is what we call a false negative. Additionally, when we do see something that's overlapping and we are concerned that it might be cancer, we'd have to call that patient to come back for additional imaging. But with tomosynthesis, what happens is you're able to split the normal from the abnormal, and that way you reduce the need for calling that patient back for additional imaging, which would also cause them a lot of anxiety, wondering what's going on, that they have to come for additional imaging. This is an ultrasound machine which we use for additional imaging once we've had a patient do a screening mammogram and found finding that we need further clarification on. So when we do a mammogram, what you'll find is you may get a finding, but from that finding you're not able to really tell whether it's normal tissue or there's a mass that's underlying it. Sometimes you see a mass, but on mammography it's not possible to tell whether it's solid or it has fluid within it, what you call a cyst. And so with the ultrasound, you'll be able to clarify that by assessing the internal characteristics of that mass. Additionally, there are women, when you do a mammogram, they'll have dense parenchyma, and that dense parenchyma may mask presence of a mass. So an ultrasound is additionally beneficial for such women to find anything that may not have been picked up on the mammogram. Now, for women aged 40 onwards who do the screening mammogram, this is what you use for that additional imaging. So what if you had a woman who has a lump and she's below 40? So that is the kind of women who would need a diagnostic mammogram. And so a diagnostic mammogram is a patient who is symptomatic and you want to find out what's going on. So in addition to them having a mammogram, for those who are between the ages of 30 to 40, they'll also have an ultrasound to clear up that area where they have the symptoms on. There are women who sometimes will also want to have a checkup done, but they've not yet reached the age of 40 where they can have a screening mammogram, and they're also not high risk, but they would require early screening with a regular mammogram, or even some patients who need an MRI. So in such instances where you have a woman below 40 and would require a routine checkup, then you start with the ultrasound. Why do we do ultrasound below the age of 40? One thing is there's no radiation, unlike the mammogram. This is the same technology that's used for imaging pregnant women when you want to assess the babies. And so it's very safe in that you don't have any radiation. And even with women who are younger and so more likely to have dense tissue, you're able to still make out the rare tissues within it. It's not a replacement for a mammogram in that they complement one another. So a mammogram is very beneficial because it picks up the earlier stages of disease or the earlier signs of cancer, which is usually something called calcifications. So calcifications on a mammogram will look like little grains of salt within the image, but that would not be picked up on an ultrasound. And that's why we would prefer to do a mammogram, because it will pick that, and that's the earliest stage of disease. However, by the time a woman comes with a palpable finding or a lump, then in addition to the mammogram, we also use the ultrasound. The ultrasound is also beneficial because you're also able to assess the armpit in greater detail compared to what you've already acquired on the mammogram. So we have two arms. There are those women who would come for a screening test and we do a mammogram, and by assessing that mammogram, we may find an abnormality that we then image with ultrasound. After that, they'll get a biopsy done that then the lab and the pathologist will evaluate and tell us that this is indeed breast cancer.